All right, welcome to the Dales Report, and today I'm happy to be joined with the CEO and co-founder of MYND Life Sciences, Dr. Lyle Oberg, back to the show. Dr. Oberg, how are things?
Well, things are wonderful.
Enjoy,
Absolutely.
enjoying the summer?
Yeah, it's nice. It's
You're-
nice. A little hot and a little bit of smoky out here in British Columbia, but not too bad.
Yeah, I was going to say, how'd you survive the heat from last week? Or was that 2 weeks ago?
Yeah, it was a couple of weeks ago. We actually hit 48 degrees, which is
Wow.
pretty much unheard of.
Yeah.
So it's pretty substantial.
Well, let's talk about business. One thing that is heating up is this industry. The industry finished strong actually towards the end of last week. Volume has really picked up pertaining to your stock. So let's touch on last week's announcement. Your company, MYND Life Sciences, provided a corporate update on its strategic initiatives to the end of Q2 2021. It involved a breakdown of intellectual property, strategic partnerships, and clinical trial updates. So if I'm an investor, what is the biggest takeaway given that MYND is so active in many different research domains?
Well, I think the biggest takeaway is that our intellectual property, including patents, is very, very strong and very,
Yeah.
very solid and very consistent with what our research is. So that's by far the biggest takeaway. I think a lot of people can do whatever they want on clinical trials, but unless you actually own the intellectual property and patents, it's pretty difficult.
Yeah, makes sense. One thing that actually caught our eye here at TDR was the efforts of Mynds scientific team that has a decade of experience identifying and examine the pathways involved in major depressive disorder. Many investors may not be aware of this given the company's short existence as a public company, but we've talked about this before, and it's something we need to continue to communicate to our psychedelic investor audience. Speaking about Mynds' strong investor research foundation and why it sets you up to be future success. So saying all this, and this is so important for people to understand this industry, research is so valid. It is so important, the quality of research that's being done. And I know you've got the right team, but what can you do? Because I know you shared this in the past with us before. What can you say where this company is, let's say in 12 to 24 months within the actual industry itself?
Well, I think in 12 to 24 months, we will have proven that the pathway that we're looking at is the pathway when it comes to regulating inflammation in the body and depression in particular, neuroinflammation. So I think we certainly will be there. I think we'll also be well into stage 2 trials, and we'll be set out to proving exactly how it works, what dosage we're looking at, and what is the best type of psychedelic to be used when it comes to helping and potentially curing major depressive disorder.
So I know, again, we've talked about this, but I want to ask an important question, something I haven't yet. If I'm an investor, I'm entering into this industry, what are some important questions that they need to know, and how does it pertain to obviously with what you're accomplishing at MYND?
Well, in psychedelic industry, we have to remember that it is all medicinal.
Yeah.
It is not a recreational drug. So what you need to ask your company and the company that you're looking at is your science solid? Is your science going to play out at the end of the day? Is it going to be the science that allows you to take a psychedelic medication through the FDA and actually get it approved for general usage, actually help people with major depressive disorder? And I think by far that's the most important thing that you have to look at. And we're well on our track, well on the way to doing that. You have to ask the how the medications work, and you have to ask why they work. And again, that's the main focus that we have.
A lot of companies are receiving now bank coverage within the industry. Is that something that you think, I'm not sure if you can answer this question, but do you think that's on the horizon for you in the back end of 2021?
Oh, I think it will be, absolutely. I think people are starting to take notice of where we are. They're taking notice of what our science is and what direction we're going. We're one of the few companies that actually has a true direction that shows exactly what we're doing, which is the how and why psilocybin in particular, but psychedelics in general work and how they actually help major depressive disorders and other disorders, I will add.
Dr. Oberg, if there's a mission statement that you can share with us when speaking with these analysts that grabs their attention and really interest in your company, what would that be?
Well, I think the mission of our company is to bring forward medications that are going to help worldwide inflammatory conditions. And the number one is depression. I think there's number 2, 3, and 4 down the list as well. But to be able to help major depressive disorder and the 300+ million people that are affected around the world, I think is massive, and I think it's huge.
Yeah. You touched on this in our last interview about the company's unique biomarkers for diagnosing and monitoring MDD appear to be a novel diagnostic tool for mapping out the origins of depression in humans. This is very important for investors to understand. So, can you explain this treatment protocol in more detail and why you're so excited about it?
Yeah, absolutely. So right now, the way depression is diagnosed is you have a myriad of symptoms. So you have to have at least 5 of 8 symptoms. They have to be present for longer than 2 weeks, and they have to be debilitating. So it's someone coming in to see a doctor and saying, I feel like this. In every other disease, or the majority of other diseases, you have a test that says, okay, you have the disease or you don't have the disease. Well, we've made the step to say that depression is caused by neuroinflammation. And with that comes the ability to diagnose it. And we have found a biomarker that has the potential to diagnose it, but more importantly, it has the potential to
Hmm.
monitor relapses and getting better. And that's really important because typically where people go hugely astray is not necessarily on the first depressive episode, but on the second and third and fourth depressive episodes where they know what is coming, the anticipation of being down in the pits of hell kind of thing.
Right.
That, that's the issue. And if we're able to catch that early by establishing a baseline with a biomarker and then determining if you're getting better or getting worse, I think that'll be really, really powerful and really huge. The
Is
other side of it is that in research and development, in some of the studies, they need an objective factor in order to be able to determine if their studies are actually going to work. And so that's what we'll be pursuing as well.
is there anyone else currently in the space that's doing that?
No, no one else in the space is doing that. And the other side of it is we'll potentially be in a revenue situation with this biomarker by
Right.
first quarter of 22. So it is something that is there and something that is real and something that is easy to do. It's simply a blood spot on a film. It's not where you have to draw a considerable amount of blood in order to test it. So it's a very good test.
So you're looking at revenue. It's probably the fastest way, I guess, to generating revenue, which is a big, big question with this industry by early 2022.
Yeah, that's what we're looking at. And again, anytime you're in a drug discovery, it does take a specific period of time. But on the biomarker side, we will be strongly out there in first quarter of 22.
What markets, like US, Canada, North America for now?
Actually, worldwide, we're
Wow.
working with a company in Australia right now. We put in a submission to the Australian government to use our
Okay.
biomarker in one of their studies, which is psilocybin and depression. We're working with a group out of Monash University in Melbourne,
Okay.
and the submission is going in actually this week.
What's that been like so far?
That's been great.
Has
Uh,
it?
yeah, people know that you need something objective. So when you say you have something objective that can define depression,
Right.
people jump at it because that's how you distinguish whether you're improving or not. Symptomatology can be very subjective and is not necessarily the best way to do it, but correlating symptomatology with an objective biomarker is huge.
Where did the idea, I guess, come from? Because it's brilliant, obviously, to say the least. But how did this all come to fruition?
Well, I think that in 2021, if there is a physical cause of a disease, so we
Yeah.
made the assumption that there's a physical cause for depression, and with that physical cause means that you can measure it. And we went out and got the biomarker that actually shows the gene, shows how it works, and with that biomarker, we're able to look at it. So I think to be perfectly blunt and honest, the biomarker is probably as big as the treatment
Hmm.
because once a treatment is there, you still have to make the diagnosis. You still
Hmm.
have to define the population that is going to benefit from the medication. And for people to understand biomarkers, these are things that they're using cancer all the time. Probably one of the first ones, and for the males in the crowd, was a PSA, prostatic specific antigen. And that is a biomarker as well. So that's what we mean by it. It's not something new and magical.
Right.
It's has been around for a long time, and presently there's something like 145 of them approved by the FDA. So this is another one that we think will have a huge place
Right.
in making the diagnosis of mental disorders.
That's incredible. What's the population of Australia?
Population about 25 million.
Okay. Do you have an idea as to like, have they looked at statistics as to like how big the population? I know we've talked in the past about the world population and being diagnosed with depression, and it's around 15%, but is it consistent with that? Do you know, in Australia?
Yeah, I think it's consistent, but I think the important thing here in Australia is that the government has recognized that the psychedelics and psilocybin in general can help depression.
Hmm.
And we're working with a group called MYND Medicine Australia, which is a not-for-profit group. And they have successfully lobbied the government to put $15 million into
Wow.
studying this. So it's a huge step forward for a government to actually accept that there's a correlation between the treatment of depression and the psychedelics. So we're pretty excited about it. I think it's going to go a long way, and it spreads our reach out worldwide
Of
because we make
course.
contacts in Australia now.
When you said MindMed, is this a separate company in Australia or is it associated with, no, okay.
No, it's not. It's not the MindMed that we know here. It's Mind Medicine Australia,
Okay.
and it's a not-for-profit.
Gotcha. Clinical trial update. Mind indicated that it has begun planning for clinical trials, as we've discussed before, to start in Q1 of 2022. So I wanted to ask, what lead indication do you expect to target as you enter the phase trial process?
Well, I think we will definitely be starting on depression. We will be starting on COVID-19 and depression. And the reason for that is in COVID-19, it's a very inflammatory state and there's a high incidence of depression. We're also looking at brain fog, which is a leftover effect of COVID. And
Mm,
people are suggesting that anywhere from 20 to 30% of people are left with CNS side effects from COVID. So we're seeing if there's a
really?
correlation there. Yeah. And then the other one, and this has to do with our newest patent, we will be entering into studies on our Alzheimer's disease and psychedelics. And that's pretty exciting because we have everything set up right now to do it. And we'll be doing our preclinicals very quickly. We have all the mice that are needed and everything to do those pretty quickly. So pretty excited about the opportunity to regress.
Yeah.
And yes, I use the word regress,
Yeah.
regress Alzheimer's disease.
Okay. Let me ask you, because that's huge. Have you ever seen that in your medical field before?
No, I haven't seen it, and I don't think anyone has. We've seen
And
it
you're
in,
now starting to see it.
yeah, we're seeing it in mouse trials. And the mouse trials tend, they're not 100%, but they certainly tend to be indicative of what can happen in humans. And it's the same process. So we've seen the amyloid plaques dissolve in mice, and
Wow.
that's huge. So we're starting to look at how to do that, and we're pretty bullish on that one as well.
Wow. Incredible to say the least. Keep up the great work. Appreciate you obviously taking the time to connect with us, but lots of great things going on. And looks like the industry is ready to take off here at the back of 2021. And you're going to be very much at the centerpiece of that. So keep it up.
Thank you very much, Jack. Great talking to you again.
You as well. Thank you.